Hi, today is December 16th, and this is part 3 of my journey after testing positive for the PALP2 cancer gene mutation. Before I go on with my update as to how I'm doing physically, emotionally, mentally, after having the 2 preventative surgeries that I had, I want to talk about 2 comments that I got on the last video that I deleted. There's no room for negative comments on what I'm doing. I'm sharing my experience, my very personal experience, basically for my mental health and to help anybody else who may have taken this genetic test or is thinking of taking the genetic test. One comment was, "Why are you even doing this? You're not the only one." Absolutely. I know I'm not the only one. I'm sharing what I went through when I was just randomly offered to take a genetic test to see if I had any of the cancer gene markers. And again, the reason why I'm doing it is because there might be other people out there who may be considering taking that test or have taken that test. So I'm just sharing my experience. I'm not promoting to have preventative surgery. I'm not promoting not to have it. Just sharing what I went through. Another comment was, "Doctors are butchers." Absolutely not my doctors. Both of my doctors, who are oncologists, remember, I tested positive for the gene, not for having cancer. They both sat me down and gave me every single possible option that I had. The hysterectomy, that was a no-brainer. I am 56 years old. I'm postmenopausal. There's no need to continue to have my uterus. I never used it, and I'm never going to use it. So that was kind of a no-brainer, but my doctor still did tell me about being tested every 6 months. Again, ovarian cancer is one of the most difficult cancers to, find. You find it stage 1 or stage 4. So that one was kind of, I know what I'm going to do with the hysterectomy. In fact, I had considered doing it years prior. The double mastectomy, that did involve a lot of thought. Again, the other doctor that I had sat me down, showed me all of my percentages and what they would be as I aged. She also let me know that there was a possibility of me just going into a high-risk category, which meant testing twice a year. 6 months I would get a mammogram, and then the next 6 months I would get an MRI. If you've never had a breast MRI, it's not the most comfortable thing to go through, especially when it's with and without contrast. That's an hour-long exam, which is a lot less intrusive than a double mastectomy. But I also know myself, and I know that I would do that 1 year, 2 years, and then after screening great, I'd stop doing it. So for me, the best option when it came to reducing my risk of breast cancer in my life was to get the double mastectomy. Now that doesn't mean that I have a 0% chance. I have just decreased my risk from over 50% to 1%. And now my update on my recovery. The drains did come out on December 12th. Super happy that that happened because now I'm a little bit more mobile. What I'm dealing with now is the tape coming off of the incision. If you've ever had a cut or a scrape where you've had a Band-Aid for a while and then it comes off, that feeling that you get when your clothes are touching it, that's what I'm going through right now. Not a pleasant feeling. When I sneeze, I still have to hold my chest because it does provide some pain. I'm wearing the binder less and less also so that the incisions can fully dry. Who knew that your chest completely vibrates with every step you take? I do now. That is not comfortable. Fatigue has set in. There's a few things that I can do and then I'm out of breath. I'm hoping that it's fatigue from the surgery and not because I'm a little, chunky. As for the hysterectomy, I do feel some pulls here and there on the inside. The incisions on the outside have healed phenomenally. I'm slowly progressing. I'll be updating you all in another week. So make sure that you're kind, especially in people's comments. You don't know what that person's going through. If you don't have anything nice to say, just scroll. Be kind.